Mhm. Good afternoon. Is there anyone in the meeting room who can do a sound check for us?
I'm not in the room, but I can hear you, Ann.
Excellent.
Yes, I can hear you too.
Welcome, Even. I see a lot of gesturing at the screen, but I don't think we're in that conversation just yet.
I just sent a chat saying the same.
Anybody hear us out there?
We can. You're faint.
Can you hear me okay?
I'm hearing faint. I don't know about my colleagues out in Zoom land.
No, I can bear. I have volume turned up all the way, and it's a whisper.
Yeah,
it's very muffled.
Okay, we're going to test again. Test. Can you hear us better?
we really can't hear you at all.
Can you hear better now, Ian? No?
My guess would be that the room audio is maybe not set to the microphones in the room.
Go back to your mute button. How about now? Testing.
Better. It works.
Considerably better. Yes. Thank you.
All right. I don't know what we did. We called the meeting to order and we've taken roll call, and we were at Preeti Joseph. And I see she's here on Zoom. And then Adam Hoffman.
Yes, I'm here. Thank you.
Thank you. Adam is here on Zoom. So we've got plenty of people here today, so we can continue. We'll begin with public comments. At this time, anyone may address the board on matters which are on the agenda. Please raise your hand, state your name and home address. Individual remarks are limited to 3 minutes. Is there anyone who would like to speak today about things that are on the agenda? Evan. Good afternoon, Evan. Go ahead.
Thank you. Yeah, my name is Evan Hudson, Program Coordinator of Dubuque Harm Reduction. I saw on the agenda is an item related to the harm reduction boxes. And I'd like to offer an update and a comment on that topic. First, the update. I spoke to, when we had our subcommittee meeting, we talked briefly about the possibility of locating one or more of these boxes downtown, possibly at a gas station. And there is one chain of gas stations that's owned by a gentleman from India named Amir. I spoke to one of the managers in his store yesterday, and he said that they're still open and willing to place some kind of harm reduction box with or without naloxone in the store or on the property of those stores. I think they have 4 or 5. What they require to move forward with that is a letter from either the Dubuque City Health Department or the Dubuque County Health Department Board of Health, just saying that it's legal and all in the clear that way. And then ideally they wouldn't have to do a lot to maintain it. But we spoke about that as a good possible location because it's a high traffic area that people probably already passed through already. Kevin Dragato brought up some concerns about possible, privacy or anonymity with that, but we could figure out. Anyway, I just wanted to update with that. And the comment is that I really feel that if these boxes get installed, they need to have naloxone in them. Not having naloxone in a harm reduction box, when the purpose of the harm reduction box is to decrease overdose and transmission of disease, I feel like we'd be missing a big part if they didn't have naloxone in them. And now that naloxone, Narcan is over the counter, there's really no legal barrier to doing so. If children having access to syringes is a concern, you can buy, there's free nasal Narcan available through state programs, and then there's funding available for that type of thing too. So I really feel that in order to ensure low barrier access to naloxone, that naloxone should be, and reduce overdoses, that naloxone should be included in these boxes.
Thank you very much, Evan. We really appreciate your input. Are there any other public comments? Hearing none, we'll move on to chairperson announcements and updates. I have just a couple of things. Of course, we all know that obesity is a problem in our country, and 35% or plus of adults in Iowa are obese, and it's an increasing problem. And to that end, I was glad to see, and I just wanted to give a shout out to the Dubuque Community Schools, the Holy Family Schools, and West Dubuque Community Schools for hosting Local Food Day. I think it was on September 27th, 23. And those schools all serve 2 locally grown foods to their students, I think that day, and just to get them accustomed to locally grown sourced foods. I thought that was a great program. And also, in today's paper, I saw that there's an urban agricultural entrepreneur fellowships. There are 4 of them. Dubuque city residents are eligible for them. They can apply for them, and they're year-long programs, and the people are paid to participate. So I thought that was a good program, again, going toward healthy food and healthy eating. The second thing that I am concerned about this month are the fentanyl strips, which are illegal in Iowa as paraphernalia. Fentanyl strips are strips that you can use, a person could use to test an illegal drug that they're about to take. And if there's fentanyl, that deadly fentanyl in it, the strip will show them and they could decide not to take it. But they're not legal here. So I urge everyone to contact their legislator and say, hey, let's make these legal. It's a simple thing. And I noticed that the Polk County Board of Health made a actual resolution to the state that they should pass a law making them legal. So that's maybe something we could consider in the future. And then the last thing I have is I've been listening to a podcast. They're just short little vignettes, maybe 10 minutes long, published every morning. And it's a public health on call. It's by John Hopkins Bloomberg School of Public Health. And it's just I don't listen to every session, but you can kind of pick and choose what you want to listen to, but very good ideas. The one I listened to today was about loneliness. And a certain hospital has started a program where they get volunteers to say that they would like to have a phone call. And then volunteers make a phone call to these lonely people once every 1 or 2 weeks. And they found that it's really helping the people with their loneliness. So just another thing that people are doing out there, and it doesn't cost much. So it's stuff that we could get involved with here in Dubuque County. Thank you for your time. Next, we have the Board of Health Liaison comments. Supervisor McDonough.
Yes, thank you. I see on your agenda today that you're going to note that the chair of the Food Policy Council, Catherine Caitlin, resigned. And I just wanted to mention the Food Policy Council and also ask, I think it directly relates to your strategic planning. Where I guess the community would like to know where you are with your strategic planning. Are you doing strategic budget planning? I believe that healthy foods is a high priority for the sport of health. I think that obesity, as Sandra just talked about, is high priority. But where are you in the strategic planning? When will it be completed? And we have, I don't know that the Food Policy Council will continue. I don't know that, that they will be able to muster enough folks to meet, even though they've gone, I think, to quarterly meetings. So perhaps Noah can kind of put a laboring oar to that as well. But I do think that the two things are in some ways combined. To Evan Hudson's comments about the harm reduction boxes, I would just wonder if the Board of Health would consider an interview question for your candidate for that position. Perhaps give that maybe even in advance as a puzzler, you know, put their skills to the test, and it would certainly illustrate for y'all how well they are connected to the community and what gaps they're aware of. This has been something that the Board of Health has been struggling with for more than 4 years. What to do, how to incorporate harm reduction, and so that I would just put that forth. Maybe your ideal candidate is going to have some powerful answers, whether what they know or what they don't know, but it would give you maybe a way to assess the candidates a little bit better. I'm not in that interview team, and that's fantastic, but I just put that forward for folks to consider. And then just a last minute note here, I received an email today. This concerns the opioid expenditure report, and the auditor here is online, and I'm certain he got the same note I did, that our supervisor, our county government statewide group, is going to have a conference on that, just a webinar. So that reporting will be done by probably Kevin. In fact, I know it'll be by Kevin, someone in the auditor's department, but that is still out there, and the state's still, you know, we're still all trying to come to terms with how to report, what's necessary, but it is time to, I think, get our staff in place and get going. So I appreciated, again, that Evan's here and talking about, I echo his comments about boxes that don't contain life-saving drugs are really not about harm reduction. So thank you, everyone. I appreciate everyone's attendance.
Thank you very much. Next, we have the approval of the agenda for today. Is there a motion? Okay, it's been moved and seconded that we approve the agenda. Any discussion? Hearing none, all those in favor say aye. 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 All those opposed? Hearing no opposition, it is passed. It is approved. Next, we have the approval of the minutes from September 20th, 2023 and September 28th, 2023. Is there a motion to approve those minutes?
I move we approve the minutes.
And a second? It's been moved and seconded that we approve the 2 sets of minutes. Is there any discussion? Hearing none, all those in favor of approving the minutes say aye. 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 Those opposed? Hearing no opposition, the minutes are approved and will be filed. Next, we have presentations and reports, and I'd like to welcome Stacy from the VNA to give her report.
Thanks, Cindy. So we've had a lot going on at the VNA. I'll start with some staffing updates. We actually currently have 5 open positions, which is quite a bit for us. Just in case you know people interested, we have our home care aide position, which has been open for quite a few years now. We still have our 2 full-time home care aides here in Dubuque, but we're still looking to add at least 1 more full-time, if not more. But that position is still open. We do have 1 applicant, so fingers crossed. We also have a full-time WIC dietitian position open here in Dubuque, and a part-time case manager in our Ryan White program here in Dubuque. Part-time dental hygienist. One of our dental hygienists will be retiring in January. She works with our Dubuque County Early Childhood contracts, doing oral health screenings in the preschools and child care centers. So we're looking for someone to fill that position, and then a part-time dental assistant position in Alcater. So just some thoughts that we do have those positions open, and hopefully we can get them filled as quick as possible. As I reported, I think I wasn't here for our September meeting, and I'm sorry for that. In August, we went live with Epic, our EMR. system, and it's been going very, very well. We continuously have a lot of kinks, but we are monitoring closely, and we just every week we meet and we'll take a look at our workflows and our program billing and making sure things are flowing well and we're not missing any revenue. We're actually looking to gain efficiencies and things like that. So we're really happy with how it's going. Our staff are getting used to the new systems. It's taking us a little longer to do things than normal, but we'll get there. I wanted to share both our maternal and child health grant year ended September 30th. So just some stats off of those programs. All of our work plan goals were met and completed in both of those programs. And throughout our service area, we were able this year to increase lead testing, immunization promotion, medical and dental, home care coordination, Hawkeye outreach, child care nurse consultant support. For maternal health, we increased our breastfeeding knowledge out in the communities. We implemented the Maternal Health Advisory Council. We increased health education for prenatal and postnatal, and we continued our doula work support. So we're really excited over what we were able to accomplish within those grants. Both of those grants serve an 8-county service area. And so we look forward to seeing what we can do this year as well. Over the last month, we've had a ton of outreach, and Allie was going to try and pull this up for me, so hopefully she's able to. I worked with Allie at the request of the board to come up with some items that we can take when we're out in the community that highlights our partnerships and our work with public health. So we did devise a tablecloth and then also a tabletop stand that we can take, and we have been using both at every outreach event that we've attended. And so we did have, I did get a picture from Kids Expo, which we just attended here this month, and that was through Dubuque County Early Childhood. We were able to work with EMA to support Kids Expo, giving out masks and sanitizer for both the vendors and the participants that came. And then that's kind of where we put all of that information. So I think it really highlighted public health. Were you able to get it up?
So I'm afraid that the audio difficulties we were having earlier were related to me being logged on through this. So I'm not going to log on, but I will forward it.
Thanks, after the meeting. So we're really excited to have that. We also attended Kids Expo, VNA did, and provided vaccinations, dental screenings, lead tests, and then we also had informational booths. We were at, we attended the Dyersville Head Start parent meetings. We attended Latinx festivals in Dyersville and in Dubuque. We attended the Steeple Square Community Fest, and we've also been present for parent classes in Western Dubuque and Cascade High School. So very excited over a lot that we've accomplished so far this month. And this weekend coming up, we'll be attending a resource fair at the Multicultural Family Center. So we're definitely getting out in the community, which I feel is super important. September, we saw our highest number of individuals meeting presumptive eligibility for Medicaid, meaning they showed up at the VNA with no insurance but are eligible. So we were able to do the presumptive eligibility packets. So far this year, we've served about 200 individuals needing insurance, and compared to this time last year, it was 134. So we've definitely seen an increase. A lot of it could be attributed to all the changes within DHS and then having to re-enroll earlier in the spring, but something we're watching. We did train a couple other staff that work with both adults and children, so we have more staff on hand within the offices if somebody walks in that we can help them with insurance. COVID, and I don't know how much Allie's going to share on where we're at with COVID, but I'll kind of share what VNA has going on. We have both the Pfizer and Moderna vaccines. We were given a small allocation through the bridge program. We did not order it at that time. We were just given, I believe, 100 doses total of each. So we did have some on hand. We've continued doing, offering them through our routine childhood vaccine clinics, our VFC clinics. And then we're also still having our Friday walk-in clinics, and we're continuing to get small amounts of people every week. Being in the bridge program, we can only give the vaccine to individuals who qualify for either VFC, which means their children 0 to 18 enrolled in Medicaid, underinsured or uninsured, or they either have to be an uninsured adult or someone who does not have zero cost access to the vaccine. So that is how it's stated through the state. It is self-attesting, so we don't call the insurance companies and verify this. It's a form that they fill out. They will mark that they do fall within the bridge program eligibility, and we can go ahead and give the vaccine. We've had a lot of requests for the Novavax vaccine. We have ordered it. It is shipped and on its way. We thought we would have it today, but I'm going to assume we'll have it yet before the week is out. Allie did put out a press release because there's been a lot of confusion and a lot of frustration in the community, which we completely understand. I think every one of our staff members feel the same frustration. Most people in the community have been able to walk into the clinic and get it when they want it. And that's been a big change, especially for our elderly, and that's really frustrating for us. I know Allie and me and Mary Rose have been working with our providers trying to get updated information. They had to order the vaccine. The estimated time of arrival of that vaccine is varied on whether or not they have it. Some have it, some don't. Some providers are only allowing online access to appointments, which is hard for some of our elderly. So it's frustrating. We get that. We're trying to get the most consistent messaging out there. Allie's done a great job at coordinating that for us in the community, and we'll continue to put out the information as best we can. And I'll kind of leave it there and let Allie, when she puts her report, I'm sure she's got more information there. We're very excited because we got some new equipment. So the state had given us, I think at the very end of last year, Dubuque County was allowed some additional funding to purchase upgraded vaccine or immunization equipment that included an ultra cold freezer and upgraded data loggers and portable freezer and fridge packs that we would use when we were out in the community. We were able to, I worked with Allie and Megan to get those ordered, and the vaccine freezer showed up. So it is at our office, and we're very excited to get that going. That would have been so useful 3 years ago, but at least it's there now. It's there for the future. We're happy about that. Every county was granted dollars to get these. So, and the encouragement was that every public health department in each county have an ultra cold freezer. I know there's a lot of counties where they didn't have it. We were lucky. We had 2 hospitals, both of them ordered one and had them on hand that pretty much saved our county in terms of allocation of Pfizer vaccine, but we're excited and it's here. So lastly, and I know Sandra and I talked and she had a question on our home care aid. Our home care aid is still a struggle because we are understaffed. We've been understaffed for about 3 years now. It's a position that's just so difficult. We have reached out to some of the high schools and started talking about that. We're working really closely with NICC and some of our colleges as well, especially looking for students who are studying in nursing and things like that that may want some additional time. We've changed our position to both full-time and part-time, and then changed our traditional hours, offering evening hours and weekends where we don't typically, our office isn't open, but if it means we can get more staff, we would love it. We currently have 43 people on our waiting list. We were able to enroll 2 new patients this month, and we expanded services on 2 current patients. So not where we want to see it, but it still remains a priority.
Thank you, Stacy.
Can I just ask, are you seeing those Friday clinics fill up? Or not really?
If every person that called in for the COVID vaccine came down, yes, we would be booked all day long. The problem is a lot of people are calling in and they have insurance, and what we're finding is a lot of them have a provider that either isn't giving the vaccine, doesn't have it yet, doesn't know when they're going to get it, and they want to be able to come to us because it's very easy access, and we get it. I hate telling people no. If somebody does come in, we give them a piece of paper, we explain what the bridge program is, you know, and we've had probably on average maybe 5. It's not a lot that actually come in. Most people are calling, so at least the message is getting out there, but it's just not one we want to give.
Thank you. Are there any other questions for Stacy? Thank you for your report, Stacy. Next, we will have the Dubuque County Public Health Department report by Director Alan White.
Thanks, Sandra. So, couple things worth noting. We have a new face to our team today. Mr. Noah Doherty was an intern with us and is now part of our permanent team. So welcome aboard to Noah as our public health coordinator.
Thank you very much. Well, excited to work with all you guys.
Again. Yeah, yep. And then also I know Sandra had welcomed Dr. Preeti Joseph at our last meeting. But again, another warm welcome to her as a new board member. And other news here quickly, I know again mentioned that the Food Policy Council chairperson had resigned. At this point, I'm not entirely sure what that means for us or what that means for the council, but we'll continue to explore what that looks like moving forward. And then worth noting is our service area, which is part of our public health emergency preparedness area in the state, has an opportunity to provide Stop the Bleed training and supplies to local school districts. So I will be reaching out shortly to our local districts to see if there's anyone who is interested in partaking in that program.
Do they teach the adults or do they teach children?
In my experience, it's been the children, or I'm sorry, the adults. Although I think a child could become a trainer, yes. Completed tasks. We had a strategic planning workshop with Evident Analytics. That was on September 29th. And we are looking into the next phase of the project, which will be phase 3. And I will be sending out a date to those that will be partaking. I think we're looking potentially at December 1st. But more to come on that. So I know, and you had a question about where we were at with the strategic planning. The planners will be in next for an entire full day session in early December. Both Bailey and I attended an ISU Extension Office grant workshop in October. There were some helpful information there. We completed our Iowa DNR annual lab audit, and that went well. There were a couple ideas that they had that may actually end up saving us some costs on supplies in the long run. And then we're also looking into the current thermometers that we have and updating them as a result of that audit. We attended the Iowa Respiratory Virus Surveillance webinar, which is an annual webinar put forth by the state of Iowa. They talked about the RSV vaccine being new, and that's something that we're exploring offering in our community as well. The COVID vaccine, we did issue a news release that was on October 11th. And basically, the way I see it is that our role has changed significantly this year. I think in the past, we were able to say, we as a local public health department were able to use those federally funded vaccines to administer to anyone. In a nutshell, the change this year is that we can no longer do that. So the question then becomes, what is the role of public health? And I think what I've learned and what I'm learning is that it's going to be educating people on where the vaccine is available. And so we do continue to work, both Stacy and Mary Rose and I, together with providers to see what barriers they're running into and if there's something that we can do to support getting them vaccines so that then they can get them out to the public. Just worth noting, our human resource department enlisted an organization to do a wage survey. So they're looking at the wages of employees across the county. And so our health department completed those as well. And then just recently, yesterday, I had the great opportunity to visit the University of Dubuque nursing students and talk to them in their community health class. And was able to talk about the community health assessment that we're currently conducting. So that was a great opportunity.
How many people were there, would you say?
In the class? Probably about 15 to 20.
Great.
Yeah. And then some of the things that are ongoing, the strategic planning, like I mentioned. Again, this is a county level initiative spearheaded by our Human Resource Department. We're holding a series of leadership workshops for the department leaders. We had the first of 3, first week in October. I thought it was productive, it was helpful, and look forward to the next 2 workshops. There will be one in November and one in December.
And do you get to go to like some fun resort for that? Or?
Yeah, right across the street. No, in all honesty though, it's a good opportunity. It's networking, and it's kind of learning what our strengths are and where we can meet one another and just kind of form a cohesive leadership team. So I'm thankful for that opportunity. Community health assessment and improvement plan. We are coming to a point where that is going to be due to the state in just about a month. My hope was to have a draft ready today to present to the board so that we could seek approval or look at modifications that needed to be made. Unfortunately, it just didn't happen. So it's due to the state by the 17th of November. Our next Board of Health meeting will be November the 15th. So it will be a short turnaround time. So I wanted to make you aware of that. It's not a position I want to be in or put anyone else in, but I think it's just where we need to be. I would share with you though that we identified through a series of community surveys and conversations the 3 priorities that will be addressed in our health improvement plan, and they're listed as improving brain health and reducing substance misuse among Dubuque County residents. That was one of the focus areas. The second was to improve access to dental care for Dubuque County residents. And then the third was to improve wellness opportunities, physical activity and nutrition specifically. And then with regards to the opioid epidemic, the project coordinator interviews will begin next week. And then an exciting piece of information, and unfortunately I'm not going to be able to share my screen like I had hoped because I fear that was maybe the cause of our audio difficulties. But as I've shared before, we're working with our GIS department to map some of the opioid epidemic related resources in our county, and I have it linked here, and I can share it afterwards as well. It's a work in progress yet, but it's able to be viewed so that you can kind of see where we're going with that. So I think that will be an important resource for our community once we can fine tune it and get it out there. I think we talked about the COVID vaccines, that we're just continuing to work with providers and communicate with our citizens where they can receive those. We did receive some additional state funding that's intended specifically for outreach and promotion of seasonal vaccines such as influenza, COVID, and RSV, and we'll be looking at ways to best utilize that funding. And one final update, we've been talking about the digitization project for the health department, and we learned that the quote that we had has changed somewhat, and so that's required us to go back out and seek additional quotes from other companies. We hope to have that wrapped up by the end of next week. And so I should know more about progress at that point.
Thank you, Allie.
I have a couple questions.
Go ahead.
First, for the GIS, 2 things. Can we put the COVID vaccinations on there where they're available?
I thought I had as well.
And then second, thank you, Kevin Dragato, for the idea that he ESP'd to me through the magic of telepathy. Can we put trick or treats on that so that the towns know where they are? And I say that not because of the candy, but because of the activity of walking from house to house, and that it's a way to combat loneliness, because I personally like to see all the kids dressed up in their costumes and engage with them a little bit as they're out for the night. So I'm wondering if we could put trick-or-treat locations on GIS as well. Or,
yes, You got me with my fish fry idea. Yes, we're completely capable, and we had actually talked about it. I don't know that we'll have it implemented for this Halloween, but definitely for every future one we will.
Thank you.
Just a question. I think as far as the booster, the COVID booster goes, that's everybody's eligible for that now. Is that correct? So 6 months and older, right?
Yeah, it just depends on when you had your last one.
Okay. And then concerning the community health assessment and improvement plan, the document that we will be reviewing is probably kind of long, right? So what I would ask is that you finish it when you can, and then maybe disseminate it out to us so that we can at least read it. And then after looking at it, we may decide to have a special meeting if we need to. I mean, if there's going to be a lot of stuff to discuss or to modify, then I think we'd have to have a special meeting, because 2 days probably wouldn't be enough. But
I appreciate that.
But we're happy to do that to help the health department. So please just you know, proceed with that. I think that was it for me. Thank you.
What's the holdup on it? Is it anything that we could help with as an hour?
I think it's just pulling all the pieces together. It's been a work in progress with a lot of data. So we're looking at different data sets that we've brought in, and then also across the state and the nation and where we stack up. It's really just pulling all of those pieces together.
And a lot of people, we have different task force for each priority and staying on task, getting all the same information so it flows within the plan. I think it's an undertaking.
And you could probably throw it together and have an okay document, but we've done a good job in getting to where we're at. I want to make sure that we finish it with something that's actually going to be
used. And
yeah, because it lays the foundation for until the next one's done,
right.
where we can see funding from and where we should focus our efforts.
I think it's a real important document. So yeah. All right. Number 8 on our agenda, action items. We have none, unless somebody else has something. We have no action items, so that's great. Response to public questions. I, for one, received a couple of questions during the month and referred them to Allie, and she took care of them. And most of it was about vaccinations. People were concerned about where to get them and what to do. So Allie took care of that. Thank you, Allie. Anybody else have any public questions? All right, and then next we have unfinished business. I think we've taken care of A, immunization messaging update. B, the Finance Committee will begin meeting with Ms. Rundy and Director White soon. I completed the supervisory section of a job description questionnaire on behalf of the Board of Health for a compensation and classification study that the county is currently completing. And the form that I completed just had to do with the director, because we are kind of the supervisor of the director. Next, the Performance Review Committee hasn't met yet. I have reached out to HR, and I anticipate hearing from them soon. The Opioid Subcommittee, like Allie said, the project coordinator interviews are beginning this next week, and we're still working on the harm reduction lockbox. The next meeting for the opioid subcommittee is November 2nd. Is that correct, Ellen? Okay. Then I have listed no new business. Does anyone else have new business? Hearing none, we can now have board communication and reports. If anyone on the board would like to speak at this time about anything that they're involved in or interested in, this is your time. Just raise your hand if you've got something you'd like to talk about. Seeing none, we will move on then to our next meeting is November 15th, 2023 at 4:30 p.m. At this time, anyone may address the board on matters which are of concern to that person, which are not agenda items. Please raise your hand and state your name and home address if you'd like to speak. Please be aware that the board is limited in Our ability to respond to such inquiries, and the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Anybody from the public like to speak? Seeing none, then is there a motion to adjourn?
I'll make a motion to adjourn.
Needing no seconds, we are adjourned. And it is 5:13. That's a record, I think. Thank you for coming, everyone.
Stacy, you have PDA 3.
Thank you all.
We do. Bye,
For the digital. Yeah, NBA.